Hello, I'm Dr. Merchant with UCLA Health's Adult Asthma Program in Thousand Oaks. In this video, we will discuss how to use your Ellipta inhaler. Slide the cover down until you hear a click. If the counter does not count down as you hear the click, the inhaler will not deliver the medicine. Call your healthcare provider or your pharmacy if that happens. To avoid wasting doses, do not open and close the cover without inhaling the medication, or you will lose the dose. Lost doses are held in the inhaler, and it is not possible to accidentally take a double dose or an extra dose in one inhalation. You do not need to shake this kind of inhaler. Your inhaler is now ready to use. While holding your inhaler away from your mouth, breathe out fully. Do not breathe out into the mouthpiece. Do not block the air vent with your fingers. Close your lips firmly around the mouthpiece. Take a long, steady, deep breath in through your mouth. Don't breathe in through your nose. Remove the inhaler from your mouth and hold your breath for about 6 seconds. Breathe out. You may not feel or taste the medicine even if you're using it correctly. Routine cleaning is not required. Slide the cover up as far as it will go. Rinse the mouth with water and then spit the water out. Don't swallow the water.